Hey, I'm Ryan Reynolds.
Recently, I asked Mint Mobile's legal team if big wireless companies are allowed to raise prices due to inflation. They said yes. And then when I asked if raising prices technically violates those onerous 2-year contracts, they said, "What the f*** are you talking about, you insane Hollywood ass?" So to recap, we're cutting the price of Mint Unlimited from $30 a month to just $15 a month.
Give it a try at mintmobile.com/switch.
$45 upfront payment equivalent to $15 per month. New customers on first 3-month plan only. Taxes and fees extra. Speed slower above 40 gigabytes. See details.
Robert F. Kennedy Jr. is back in Washington this week. He's meeting with the Senate, hoping to convince members he should become the nation's next health secretary.
I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services.
During his hearing with the Senate Finance Committee yesterday, Kennedy's views on vaccines came under sharp questioning and criticism from Democrats.
He has made it his life's work to sow doubt.
But peddling in half-truths, peddling in false statements.
Are you supportive of these onesies?
I'm supportive of vaccines.
Mr. Kennedy, it's just a really simple question.
Kennedy testified he supports vaccines and good science.
Senator, I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those vaccines.
Kennedy's pledge to not make it difficult or discourage people from taking the measles or polio vaccines did little to assure his critics.
I am extremely concerned that as secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die.
What worries some senators and many public health officials is how much power Kennedy would have to shape vaccine policy as the nation's health secretary. It turns out one of the most important levers he would have is control of an obscure committee whose influence shapes how doctors treat patients, public health practices, and even has the power to move markets. Today, the most powerful committee you've never heard of, and the control Kennedy would wield as HHS secretary. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. Joining us to talk about this committee and its influence over vaccines is Tradeoffs reporter, producer Melanie Evans. Hi, Melanie.
Hey, Dan.
Okay, so before we talk about Kennedy, let's first focus on this committee. It's called the Advisory Committee on Immunization Practices. In a sentence, Melanie, what does it do?
Well, Dan, this is a group that for the most part makes recommendations about who should get vaccines to the Centers for Disease Control and Prevention.
Okay, and to be clear, this committee, which goes by the acronym ACIP, is made up of clinicians and scientists who advise the CDC. I mean, the CDC ultimately has to sign off on those recommendations, right? So how much power does this committee actually have?
Fair point. I talked to lawyers, public health officials, and vaccine developers about this. Robert Hughes IV, he's an attorney who represents drug makers. He summed up what I heard pretty succinctly.
It is the most important policy-making body with respect to vaccines in the United States.
ACIP's influence, Dan, it's pretty broad. Doctors follow its recommendations. Their decisions guide school vaccine mandates, health insurance coverage. People even told me ACIP sways drug development.
Why do so many people put so much faith in this obscure little committee?
Sure, I can answer that in a few ways. First, the committee is influential because over the last 60 years, many doctors and public health experts have developed a high level of confidence in its decisions.
The ACIP is one of the most important points in the vaccine world because it's such a trusted body.
That's University of California, San Francisco professor Dorit Reiss. Dorit ticked off a whole list of why this body is so trusted, and it starts with that the members have a lot of expertise.
Second, the recommendations are very detailed, very fact-heavy. So the content of the recommendations is heavily science-based. And third, transparency. ACIP meets in public. Their recommendations are also public. They're published. But the meetings themselves are also recorded and heard, so it's not a behind-closed-doors organization.
But more than transparency, Dan, what the committee is doing is hard work. You've got these 19 scientists and doctors whose job is basically to keep tabs on all the research and data about diseases and vaccines, which, of course, just keeps changing. And for the people who do it, it is basically a second job. Take Sarah Long. She served on the committee for about 3 years. Sarah says she squeezed in roughly 40 hours of meetings over several months to consider a single vaccine. Her day job, by the way, is pediatric infectious disease doctor and professor.
Having grown up in Alaska was probably helpful. You know, you just did a lot of things. If you wanted to go skating, you went and swept off a glacier.
That's intense.
Skating on a glacier or the workload?
I mean, both, right? But one definitely sounds harder.
Absolutely. Sarah was one of 94 people who worked on this one recommendation. A thing I learned, Dan, interviewing people like Sarah, is that their commitment to this work is real. They are so devoted because they understand the stakes. Dr. Paul Offit from the Children's Hospital of Philadelphia has also been on the committee.
I mean, you're taking the responsibility for this country's children often, and your heart is in your throat all the time because you're so worried that you might miss something, because these products are given to healthy people, including healthy young children.
All right, so you're really starting to paint a picture for me, Melanie, why this committee is so influential. You've got a bunch of vaccine experts who get together, combing through all this evidence and data and stuff, trying to figure out the best vaccine recommendations. They've been doing this work since the 1960s, and all of their work is out in the open.
That's why there's so much trust in this committee. And the CDC almost always approves their recommendations, which touch many of us.
How does that happen? How does it touch so many of us?
Well, it's a few things. One, their policies are followed by lots of doctors when they give vaccines to patients. States look to ACIP to know which vaccines students need for school. And finally, federal law requires most health insurers to make ACIP-recommended vaccines free.
Wow. I mean, this committee really does have a wide reach.
Yeah, Dan, its influence touches us in lots of ways, either directly or indirectly. I definitely didn't realize that when I started my reporting. But I have saved, perhaps, ACIP's most direct power for last. It makes critical decisions for what's called the Vaccines for Children program. And before you ask me what the Vaccines for Children program is, Dan, it's basically a blank check from the feds to states and doctors to buy vaccines for vulnerable children.
How many kids does it serve, Melanie? How big is this program?
Right. About half the nation's children are eligible for these free vaccines, and Congress gave ACIP the power to choose which vaccines will be included. If ACIP approves a vaccine, federal funding is guaranteed. If not, no money.
This is why lots of public health folks are nervous if RFK Jr. is confirmed. Given his anti-vaccine comments, many that have been totally debunked, through ACIP, he could end up with a lot of power over vaccine policy. When we come back, how Kennedy could change the committee, and public health officials begin to draw up Plan Bs.
Hey, I'm Ryan Reynolds.
Recently, I asked Mint Mobile's legal team if big wireless companies are allowed to raise prices due to inflation. They said yes. And then when I asked if raising prices technically violates those onerous 2-year contracts, they said, "What the f*** are you talking about, you insane Hollywood ass?" So to recap, we're cutting the price of Mint Unlimited from $30 a month to just $15 a month.
Give it a try at mintmobile.com/switch.
$45 upfront payment equivalent to $15 per month. New customers on first 3-month plan only. Taxes and fees extra. Speed slower above 40 gigabytes. See details.
Welcome back. Melanie, before the break, you walked us through the broad reach these vaccine advisors to the CDC have. Let's talk now about what power the HHS secretary has, whoever that is, over this advisory committee.
Sure, it's pretty straightforward. The ACIP is what's known as a discretionary committee. That means it exists because the HHS says so.
Okay, does that mean that the HHS secretary can shut it down?
Yeah. And in fact, the agency has to agree every 2 years to let the ACIP continue. Now, Kennedy has questioned the committee's integrity. He alleges its members are in the pockets of drug makers. To be clear, the ACIP has ethics rules that say members must disclose any financial conflicts and sit out any votes where they have personal financial interests. Kennedy may distrust the committee, but people I spoke to said he probably won't go so far as to end it.
What did they think was more likely to happen?
So the secretary can appoint people. The folks I talked to said Kennedy could fill those seats with people who share what's been called his vaccine cynicism. Right now, there are 4 open seats. Another 4 members have terms that end in June. Adding 8 new members to a committee of 19 who are vaccine skeptics could be disruptive.
Doing some quick math here, 8 seats on a board of 19 fall short of a majority.
Good work, Dan.
Thank you.
You're welcome. But here's the thing. The secretary also has power to remove existing members. I spoke to public health and legal experts who think this is possible.
Okay, so, and I know this is entering the world of speculation, but if Kennedy stacked the committee, what could happen? Or at least, what are the people you interviewed afraid could happen?
Okay, so ACIP recommendations fall into 2 broad categories. Vaccines you should get and vaccines you might want to get based on your health. And the committee has the power to roll back strong recommendations. The vaccines you should get in favor of the softer ones, those vaccines you might want to get.
Got it.
These softer recommendations can be time-consuming in practice, right? Doctors and patients talking it out. It can be confusing for physicians. Should I give my patient of the vaccine or not? And a CDC study found, no surprise, softer recommendations are a challenge to follow.
Makes sense.
And, quick anecdote, Dan. In 2019, the committee did switch to a soft recommendation for older adults for a vaccine that treats a serious bacterial infection called pneumococcal disease. Few older adults got the vaccine, which was the point, and the drug maker, Pfizer, said sales dropped. Now, people told me they fear Kennedy could name members who would switch more vaccines to those softer recommendations, even when a strong recommendation is warranted. That, obviously, could lead to fewer people getting vaccinated. This is how Kennedy could make good when he says people should have a choice to get vaccinated and information to make that choice.
Right, because Kennedy has been saying he wants people to have access to vaccines if they want them. And the softer you might want to get this recommendation doesn't take anything away, but it does make it less likely people will get their shots.
Yes, people worry we could see more preventable disease in the United States as vaccine use drops off.
How realistic is that concern?
Obviously, we won't know unless Kennedy becomes secretary. I contacted staff for Kennedy and President Trump, but didn't hear back. But people are taking this risk seriously. Credit analysts warned investors the market for vaccines could shrink. And if that happens, we are likely going to see fewer new vaccines, or at least they will take longer to get to market. Here's a great example. The Danish company MinervaX is developing a vaccine that's been on the public health wish list for a very long time. It's to treat an infection that causes an estimated 90,000 infant deaths globally each year. CEO Per Fischer says his company needs more money to fund the 3rd phase of clinical trials, but if Kennedy is confirmed, he believes it'll get harder to raise that money.
I think people are sort of applying this wait-and-see kind of approach and then hoping it's not going to be as bad.
Can you explain a bit more, Melanie? Why are people in the industry anxious?
Private investors play a huge role in paying for the upfront costs.
Like the 3rd phase of clinical trials.
Exactly. And they do that in hopes there's a hefty return at the end. But the market for vaccines is already limited. In most cases, we take vaccines once or maybe once a year, and the money comes from the fact that many people who can get vaccinated actually do. With weaker vaccine recommendations from the ACIP, that pool gets smaller.
And so that concern is a smaller payday means it's harder for drugs like MinervaX to raise money.
Yes, and arguably worse than investors and the company losing out, we all lose out on the public health upside. In this instance, the chance to reduce infant mortality. Per Fischer told me he's concerned about what could happen in the short term, but he's grimly confident in the long-term demand for vaccines.
I believe that if you start killing childhood vaccinations broadly and parents start noticing that their infants become sick with measles and other, serious childhood diseases, then ultimately I believe that science will prevail and that people will actually ultimately understand that vaccines are good.
So, Melanie, investors and drug makers are bracing for what might be coming. I know, though, you've also talked to public health officials who are relying on funding through the Vaccines for Children program. What are they saying?
Right. I talked to Ron Balajadia from the Hawaii Department of Health. About 56% of the state's children are eligible for free vaccines. And he said that is not cheap. Hawaii gets around $19 million from the feds. He says the health department is talking with Hawaii lawmakers about coming up with a backup plan in case ACIP cuts the funding.
How can the state government afford that? It would be one question. And can it afford it? We're still looking through that. We're still trying to understand better what that looks like because it's going to be a lot of money.
I'm really curious. What's the mood right now?
Ron says he's been talking to counterparts around the country, and lots of people are worried, kind of on pins and needles. For Ron in particular, he's seen firsthand what happens when there are outbreaks that impact kids, and it's scary. About 20 years ago, the CDC sent him to the Federated States of Micronesia to help stop the spread of whooping cough, also known as pertussis.
I went to a very small island in the Pacific, and I got off a boat.
He was met by a distressed mother and a local healthcare worker holding a baby.
I would say maybe 7-8 months old, that was blue and trying to cough, but was throwing up and was coughing at the same time with spasms of pertussis.
The worker asked him to help. Ron tried to make sure the child didn't choke as it vomited.
And there really isn't anything we could have done. We didn't have any medical equipment at the time.
He still remembers that moment, Dan, almost 2 decades later.
It haunted me in the way that I wanted to help, but I couldn't.
The child ultimately survived, but Ron said illness could have been avoided if the baby had had access to the vaccine. After all my reporting for this story, Dan, this is a vivid example of what public health officials see is at stake.
That if Kennedy is confirmed, we could end up in a situation where there's a lot of suffering needlessly?
That's right. You remember when we were talking about the pneumococcal vaccine?
Yeah, the one ACIP gave a soft recommendation to that led to the downturn in people who took it.
Right. Well, that was a decision the committee made after carefully reviewing the evidence. The people I talked to said they're worried Kennedy will appoint people who will make decisions regardless of evidence.
And if he does that, Melanie, not only does he undermine, I'm guessing, the trust ACIP has built up over the last 5 decades, he's also undermining basic science, which could lead to the kind of suffering Ron saw with the whooping cough.
Yes, that's the real worry here, Dan.
Melanie Evans, thank you so much for your reporting on this story. I know you will continue to watch it closely.
You're welcome.
I'm Dan Gorenstein. This is Tradeoffs.
Thanks for listening to Tradeoffs. If you've just discovered us, remember to subscribe to the feed so you never miss an episode. Subscribing is free and easy on whichever podcasting app you use, the NPR app, Apple Podcasts, Spotify, wherever you listen to podcasts. The Tradeoffs team is producers Melanie Evans and Ryan Levy, editor Deborah Franklin, executive director Jessica Silverman, marketing director Catherine Dougal, audience engagement lead Shannon Crane with help from Kate Seepy and Cedric Wilson, sound designer Andrew Perella, executive editor Dan Gorenstein, and senior producer Leslie Walker. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Additional thanks to James Hodge, Michelle Fiscus, Ann Schuckett, and Glenn Rockman. Thanks also to all our listeners who helped to support our work, including Lee Moss, Tom Baker, Carolyn Engelhart, Pierce Gendron, and Todd Didier. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.
Do you have an oddly specific sleep problem? You're in luck. The Oddly Specific Sleep Problem Sale is happening now at Mattress Warehouse. Whether you're a sarcastic sleep talker or the even rarer sleep giggler, enjoy a 1-year price guarantee on a huge selection of brands you can trust. Worry about the things you say, not the price you pay, with 0% interest financing. So where would you look to find the perfect mattress? In a little mattress store or Mattress Warehouse? Visit mattresswarehouse.com.